A child is every person's most valuable possession. People think about homes and cars, and all those things come secondary to a child's life. And when they entrust the care of a child to me, they're handing over the most valuable possession in the world completely to my care, giving their trust to me that I will do what's best for that child. And then being able to take a sick or injured child and make them well, watch them laugh and run out the door into mama's arms and look at the joy that's on the parents' faces. There's nothing that beats that. It's the best job there is.
From your baby's first breath and everything that follows, Centennial Pediatrics has been improving the health of children in Middle Tennessee for over 20 years. Founded in 1990 by Dr. Eddie Hamilton, Centennial Pediatrics has grown to be Tennessee's largest private pediatric practice, with over 50 board-certified pediatricians and nurse practitioners in 11 locations and one specialties office across 5 counties in the state. Our long history in the Middle Tennessee community is a testament to our commitment to advance the health of our children and our community through exceptional care, patient and parent education, and research.
What differentiates Centennial Pediatrics from all other practices in Nashville, that's easy. First of all, we are one of the largest practices in the whole entire state. But sometimes being bigger is not always better. In this case, it is. We have practices all over the city, so all the way from Spring Hill all the way up to Clarksville and all different types of communities.
What I like and my family likes the most about Centennial Pediatrics is the convenience. We know that there are other locations, regardless of where we're at in Tennessee, that if my children need to go to the doctor, there is someone that will see them and they will be compassionate and caring and take care of them.
I think one of the things that our family likes most about Centennial Pediatrics is being able to call and always being able to be fit in for the day. It doesn't matter if it's late in the afternoon. And a good example is a few months ago, my daughter called me as soon as she got home from school at 3:30, and she said, "I've been cold all day," and then I took my temperature. Mom, I have 103 fever. And I was able to pick up the phone, explain what had happened, and at 4:45, they still squeezed her in.
Centennial Pediatrics is different from a lot of other care providers in Nashville in that the bottom line is taking care of children. That's what Centennial Pediatrics is all about. They stick to the bottom line of care for the patient comes first. Taking care of children is the main goal and the main issue. They don't discriminate based on insurance. They take all comers. Every child needs care. Every child deserves to have good medical home, and that's what makes Centennial Pediatrics special.
In addition to just taking care of primary care needs, which in itself is a big task, we also tackle pediatric dermatology, adolescent medicine, and adolescent gynecology. We have a specialist that does that. We also have a provider that specifically deals with developmental concerns, and sometimes accessibility to developmental pediatrics can be very tough. We probably have the most diverse group of providers, patients, and staff that you're going to find anywhere.
One thing about Centennial Pediatrics and what they mean to our family is basically just that, family. Our relationship with them has never been a doctor that seems far away or distant. They're always there when we need them. I don't think I've ever felt like just another patient. I think if anything, I have felt like my child was the only patient. And by knowing that you have a staff that you're on a first name basis with, that you can call, and when they answer they say, "Hey, how are you today?" That's a very different feel, because there's so many doctors and so many hospitals and so many facilities that are needed these days that at times I think it can seem like you're just a number, but we've never felt that way.
Centennial Pediatrics was an easy choice for me because it allows me to have the freedom to do what I need to do to take care of a child. I'm not constrained by corporate politics, hospital politics, generating charges or dollar bills. My main concern is to make sure that I'm taking care of the children and that they have the health care that they deserve.
Centennial Pediatrics has impacted my life in the way that I think about taking care of children. When you train as a resident, everything is already integrated for you. When you take care of children, there's always a psychiatrist, there's always a cardiologist, there's always someone you can refer to. I think one of the things that Dr. Hamilton has instilled in all of us is that we as primary care physicians need to be the ones that navigate and advocate for our patients. It's impacted my life in that I think about myself a lot more like an advocate and not like just a pediatrician.
We walk in and they know my children's name. They have a smile on their face. They're always willing to help in any way, whether it be a billing question or just a general question, unrelated to maybe a health question for my kids. The nurses are absolutely wonderful. They understand because they have kids of their own, so they understand that when we bring our kids to the doctor, there's a reason. But everyone is fabulous. I mean, they go out of their way to make sure we are taken care of. Providers, nurses, front office staff, everyone. They're great.